Hello, my name is Dr. Jaeseok Kang. Today, I would like to tell you about how digital implant prosthetics should be performed after the surgery using DioNavi. I am the director of Yedam Dental Hospital in Mok-po, Korea. I am also teaching students as an adjunct professor at the Prosthetics Department of the Dental College of Chosun University. I completed a residency in prosthetics after graduating from dental college. Currently, I am working with an implant company called Dio Implant as a lecturer for the NYU Continuing Dental Education Program. This is a photo of our clinic. Yedam Dental Hospital opened in 2001, and I have been working in the hospital at the same location over the last 20 years. We have our own in-house digital dental lab. We provide treatments for each specialized area of dentistry in the clinic, and I am in charge of treatments related to implants and prosthesis. Many companies are talking about the guide surgery system nowadays. By using a guide, it is possible to perform immediate loading and maxillary sinus surgery. Although introductions are being made for diversified guided surgeries, companies that develop devices and introduce methods of digitally performing implant prosthetics are rare. Dio has been pursuing extensive researches and introducing guide surgery systems for a substantial time and has been seeking the advice of clinical dentists for the purpose. As such, I am also assisting with their efforts in developing and introducing diversified methods while using them. To perform digital prosthetics in general, we need to create a digital dental clinic. We created a digital dental clinic in 2014, earlier than most other dental clinics in Korea. As you can see here, we scan the oral cavity of the patient with an oral scanner and send data to the dental lab for design by using the oral cavity data or model data. In addition, we perform milling on zirconia through our milling equipment, and we are operating an in-house digital dental clinic that prints the produce with 3D printer. The pieces of equipment with functions that are different from each other communicate with a single language committed for this purpose, referred to as STL files. STL file is an open source that allows you to manufacture prosthesis by using software or a milling machine, even if you use a different oral scanner and model scanner. The main data of open source can be printed by means of software or milling machine with STL file. As you may already be aware, there are two different digital systems. There are open systems and closed systems. Companies like 3Shape have an open system that is compatible even if programming and milling machines are used that are different from the scanner of the company. However, in the companies like Serac, it is possible to manufacture digital prosthesis only if they use the oral scanner and milling machine of that company. Fundamentally, a digital system can check the scanned data on the oral cavity using corresponding software through the use of an oral scanner or model scanner. There are two types of software. Using software for designing, CAD and milling cam software, orders are given for designing and milling. Then we receive orders with milling equipment for processing. Nowadays, a 3D printer with different formats is used extensively as well. Metals and zirconia are processed with a milling machine. However, products such as guide, temporary tooth, temporary splint, and TMJ, temporomandibular joint splints, are outputted by using a 3D printer. This oral scanner has already been introduced extensively 4 to 5 years ago. Accordingly, it was possible to achieve a very high level of precision and functions for the oral scanners at the moment. In particular, several scanners are already fully acknowledged and used in various areas of dentistry. Scanners manufactured by 3Shape and Serac, as well as by Medit in Korea, are widely known as outstanding scanners. As a word of advice, numerous scanning methods have been introduced to reduce errors in the process of scanning during the initial stages of scanner development. One such method, as you may already have read from the thesis, is the format of connecting sections that have already been filmed, that is, stitch format, as in the case of video format scanner. It employs the format of scanning the desired area by connecting all areas of the oral cavity. Therefore, if the direction of scanning is changed or rotated suddenly, distortion will occur. In the case of Type B among the following 3 scanning formats, that is, if you want to scan full arch, selecting the format of scanning the entirety at the desired occlusal surface before connecting the buccal surface and lingual side is a method that can reduce error substantially. Otherwise, if distortion and rotation occur in the case of A or C, extensive errors will occur in the full arch scan. The open system I mentioned can access ExoCAD with a 3Shape program and scanner. It is compatible with other milling machines, thereby markedly improving its compatibility for various relevant works. Therefore, it would be great to purchase the equipment. If you want to utilize a variety of equipment well, such as scanner, software, and milling machine together within budget. If you currently have CBCT, scanner, implant studio, and 3D printer in your clinic, it is possible to conduct guided surgery within 2 hours. This is actual footage broadcasted live at the DO International meeting 2 years ago in 2019. After training to complete all the relevant tasks within 2 hours for surgery on this patient who has lost a single central incisor, the actual procedure was completed during live broadcasting. It included approximately 7 minutes of oral scanning and 3 minutes of CT scanning. Then these data are transmitted to the implant studio to determine the implant position. In the past, when we perform immediate loading after extraction, we either use the ready-made abutment by shaping it or the custom abutment designed in advance. However, if a patient who visited the clinic today wants surgery without the aforementioned procedures, it is possible to conduct surgery without any problem if digital abutment is chosen. If you look at this live surgery, printing takes the longest time mainly. It takes approximately 50 minutes for printing, including the cleaning time. However, many printer companies are competing severely for the output speed of their products nowadays. Therefore, it is possible to output the products in a substantially shorter time. As far as I'm aware, it is now possible to output a single temporary crown tooth as quickly as in 6 minutes. The extent of progress and advancements are made in 3D printing. Therefore, the time taken for producing implant guides and performing surgery on the patient can be reduced substantially now. If you look at the video, it takes about 1 hour and 50 minutes for production and 5 minutes for the actual surgery. The remaining 1 to 2 minutes are used for connecting the prosthesis. If you look at it, the surgery using the guide surprisingly does not take that much time. By using the products manufactured in advance, it is possible to perform implant and attach temporary prosthesis on the same day. Then, what is digital implant prosthesis? Zirconia was a revolution in the area of dental materials. Until now, it had been possible to restore an extensive range of teeth using zirconia, including incisors, that used to be made of a more transparent and fragile material. Strength is an advantage of zirconia. Since it is possible to produce sufficient strength equivalent to that of metals if the thickness of more than 1 millimeter can be maintained for zirconia, it is possible to use it for molars after the staining process to make it similar to natural tooth. In addition, the amount of tooth that has been deleted reduced substantially. In the case of all ceramic, deleting approximately 1 millimeter is required in general. However, in the case of zirconia, the procedure can be carried out even if 0.1 to 2 millimeters is deleted. However, it will result in a slight drop in strength. You can see here that the strength drops slightly following the thickness. Since it maintains a strength of about 500 megapascals, even at the thickness of 0.1 millimeters, it is possible to make a prosthesis with zirconia with enormously outstanding strength in comparison to the existing ceramic and resin block. Accordingly, knife edge is actually used extensively. In addition, as you can see, even if the transparency increases and strength drops, it is possible to use zirconia for areas such as incisors that require an aesthetic appearance. Hybrid prosthesis contains resin tooth and diversified structures within the metal structure, thereby requiring a lot of space due to its increased thickness. Due to the use of zirconia for prosthesis nowadays, the height required for a hybrid prosthesis in the past is no longer necessary. Accordingly, it is possible to place zirconia prosthetics sufficiently in the occlusal plane of more than 10 millimeters if there is space for remaining alveolar, even if there is no space that was previously occupied by a hybrid prosthesis in the past. Multi-unit abutment, which is an abutment in the range of diversified length, can be seen on the right. This is an essential prosthesis for the hybrid prosthesis. It has diversified thicknesses in the range of 4.3 to 8 millimeters in general for each manufacturer. Therefore, if 3 millimeters of tooth height and 2 millimeters of zirconia is added to this structure for a total height of approximately 10 millimeters on the average, with a range of 9.35 to 13 millimeters, you can make a zirconia prosthesis. If it is possible to secure digital data of edentulous jaw, you can design on the edentulous jaw data like the above. Then this is manufactured with zirconia and aligned within the oral cavity of the patient. Many companies are now using face scans or a diverse range of programs, such as the SMILE program, to align the patient's smile line and oral cavity with the prosthesis. Then zirconia prosthesis is produced like this. Multi-unit abutment, which is the connecting link in the middle for hybrid prosthesis, has a base as you can see here. This base is also referred to as housing. The height of this prosthesis differs depending on the manufacturers. Therefore, it is necessary to acquire information such as the height of this structure first. If you apply such information here, you can discern the height of zirconia of multi-unit abutment and the final height of the hybrid prosthesis of the company you want to use.
하이브리드 보철물 높이가 필요한지를 알 수가 있어요.
This multi-unit abutment can also be attached in a straight type like this. It can be attached on top of an angled multi-unit abutment with a tilted angle. Metal can be processed for other digital prosthesis, as you can see here. So you can design a custom metal structure on custom abutment or bridge and produce it through a milling machine. It can also be produced with zirconia, as illustrated in the middle. Prostheses can be diversely designed. In particular, placing implants in defective areas with a substantial lack of bone was avoided very often due to severe aesthetic disadvantages. However, it is possible to achieve prosthetic restoration even for areas with substantial defects through the work for simultaneous processing of the configuration of gum on top of the tooth and staining it later on due to the development of zirconia and software nowadays. Digital prosthetics have advanced markedly in such aspects. As such, it is not only possible to manufacture implants, but also the prosthesis model by using a 3D printer now. Recently, a printer that can process metal was introduced. So a prosthesis for which porcelain is built upon them is now being introduced. In addition, a working model of implant prosthesis is already being manufactured by using a 3D printer. 3D printing model capable of processing abutment or building up porcelain on top of it is being introduced. I will now introduce several methods of digital prosthetics following DO-NAVI procedure. As you can see here, DO classifies and has scan body corresponding to impression coping and digital abutment similar to the tooth size and stock abutment that the doctors have. What is important is that digital abutment, H-scan body, custom abutment, and stock abutment are compatible with each other. As such, it is possible to select the stock abutment under digital software after having scanned the scan body. Designing the custom abutment through scan body is a natural process. Moreover, it is possible to choose digital abutment since they are compatible. However, due to the promise DO made with 3Shape that made this possible in the initial stage, I believe it is not possible by other companies. Therefore, the technology of selecting stock abutment with scan body can be deemed as the only digital treatment method that DO has. There are two types that are scan body and H-scan body. One on the left is the ordinary scan body. One on the right is the H-scan body. H in H-scan body is abbreviation of healing abutment. Once healing is completed, connect H-scan body instead of healing abutment after the surgery to scan with an oral scanner or take a model impression in its condition. Then it is possible to choose from diversified options, including manufacturing custom abutment with this or selecting stock abutment. Those H-scan bodies seen at the left bottom are numbered classified into those for incisor, small molars, and molars. So you can refer to these when using. If you look here, it can be seen that the flat surface portion of all the scan body is made under the principle of matching with the direction of hex. So you can assume that each scan body or scan body plays the role in digital of a coping used in the analog method.
보시면 될 것 같아요.
Next is digital
다음으로는
abutment.
디지털 어버트먼트입니다. 디지털 어버트먼트를 만든 이유는
The price of digital abutment is somewhere in the middle of those of custom abutment and stock abutment.
중간 가격입니다.
Since it has significant price competitiveness with its interim price range and is a ready-made product, matching is possible due to the library already created if it is scanned in the oral cavity. Matching signifies that it is possible to view accurate margin in digital work, even if the margin is at the bottom of the gum. In the actual oral cavity, it is difficult to scan the bottom of the gum. Therefore, digital prosthetics with the emergence of scan body and digital abutment became markedly more precise and convenient in comparison to the conventional analog method. As such, it is possible to make prosthetics very easily by connecting oral scanner and scan body, or digital abutment with stock abutment. This digital abutment is available for each size, for each tooth, including incisor, small molar, and large molar. Since it has gum height and scallop-type marginal format and is available as a ready-made product, it is possible to use them more conveniently by purchasing them and using appropriately. The next is stock abutment. The prosthesis is designed after placing the stock abutment in the mouth, taking images, and selecting the library. This, as explained above, is an unparalleled method of DO. This is because other companies are not able to do this work at the moment, even though they may be capable, due to the already existing contractual relationship. I'm using this method quite frequently, and the competitive price is one of the advantages of the ready-made abutments. Accordingly, dental clinics, when producing prosthesis with ready-made abutment, by using the oral scanner and/or impression, can make it with the more convenient acquisition of impression rather than ordinary coping impression. This is a method that our hospital introduced extensively. It can be seen that the margin changes for many custom abutments used after immediate loading. Then the new design has to be made, which induces substantial economic losses. Therefore, the margin is adjusted in or out of the oral cavity, and this is imagined with the scanner. These two sets of data acquired from scanning by connecting the custom abutment in the oral cavity again are merged in the program referred to as dental system. In a way, we are using the abutment that has been modified by having it stored in the library on the patients as it is. Such method is named as a double scanning method and is being used widely even now. I will now perform digital prosthetics with such a technique. I will explain while looking at a case. This case was done 3 to 4 years ago, and immediate loading was done after tooth extraction by using the guide. Then, particularly in this case, immediate loading was performed while leaving the shield on the buccal side. Once healing is completed, it is possible to design zirconia abutment connected with link by using scan body. Zirconia crown can be produced for the outer portion. In this method, although it is an incisor, all the works were carried out in the digital method. This is a stock abutment case I explained earlier. Maxillary surgery is performed using the guide. Then the sinus membrane is lifted by using water pressure and bone grafting before placing the implant. An advantage of placing the implant using the guide is that paralleled implant placement is possible. Parallel placed implant achieves accurate path even if ready-made abutment is connected.
패스가 정확해요.
Therefore, a paralleled, ready-made abutment is scanned in its condition without having to use other methods.
그대로 그냥 스캔하는 겁니다.
Once they are scanned,
스캔하고 나면
a ready-made abutment is called up in the software program.
프로그램에서 이 기성품 어버트먼트를
We bring it up to design the final prosthesis on top of that, and then manufacture with zirconia and send it.
그리고 나서 질코니아로 제작해서 보냅니다. 즉 실제
That is, there is no need to move the model back and forth or moving ready-made abutment between the dental clinic and dental lab.
서로 왔다 갔다 하거나 이런 게 없죠. 바로
This is a case that illustrated to you that a final prosthesis is possible only with data, without the need for a model.
보여드리는 케이스죠.
This is the double scan method I mentioned a while ago.
더블 스캔 방법인데요. 환자는
The immediate loading after the tooth extraction is performed, and then the temporary tooth was placed on custom abutment planned in advance for the patient.
템포러리를 했습니다. 그리고
Since there is a change in the gum like this 2 months later, the custom abutment margin is changed.
마진이 변하죠.
Then, this is deleted outside the oral cavity for modification before scanning with the scanner.
그리고 스캔합니다.
Data will then be created.
데이터를 만들죠.
This is then put into the oral cavity again for imaging. When it is put into the oral cavity, marginal gingiva cannot be seen. However, when we call up these two data into the dental system, they can be matched with each other.
서로 매칭을 할 수 있어요.
Therefore, it is possible to design the final prosthesis by checking the margin.
디자인할 수 있습니다.
As you can see, it is matched like this.
매칭을 하죠. 매칭을 하면
Once they are matched, the margin is visible in the digital model.
모델에서는 변연히 보여요. 그리고
Once the design for the final prosthesis is completed for zirconia, produce only this with zirconia and send it to the dental clinic to replace it with the temporary prosthesis that the patient was wearing until then.
환자가 장착했던 임시 보철물과 교환하는 거죠. 네, 요걸
This is one of the methods that I have been using over the last several years.
그런 방법 중에 하나입니다.
This allows model-less production between the dental lab and dental clinic. How about a full mouth implant prosthesis?
임플란트 보철은 어떨까요? 풀마우스 임플란트
Many people are doubtful whether a full mouth implant prosthesis is possible through digital work without a model.
많은 분들이 의구심을 가지고 있죠. 실제로 많은 회사들이 가이드는 이미
Although many companies produce guides, there still is no technology capable of connecting even digital prosthesis on top of guides for full mouth implant placement.
까지 연결할 수 있는 그런 기술력은 아직 없는 것 같아요. 그래서
Therefore, a kit is necessary to place a full mouth implant.
물론 키트가 필요합니다.
However, there are not many companies that have this kit.
이 키트는 보시는
This kit,
것처럼
as you can see, is equipment to accurately fixate a full mouth guide.
하기 위한 그런 장비들이고요, 기구들이고 요거는
This plays the role of accurately fixing the guide and the placed implant during and after the implant placement.
정확하게 잡아주는 역할을 합니다.
This will assist to place other implants in the accurate location.
정확한 위치에 임플란트가 신입될 수 있게 도와주죠. 자,
One of the things we must know for full mouth implant restoration is the occlusal vertical dimension and the centric relation used in an ordinary prosthesis.
교합 고경과 중심이를 여러분들이 아셔야 됩니다.
In a way, it is the same process.
어떻게 보면 그래서
Although it is general, you can deem that this is applied equally to full mouth restoration of the implant.
되겠어요. 자, 교합
An occlusal vertical dimension that we know of is the position determined by subtracting about free 2 to 4 millimeters, referred to as a freeway space, by measuring the distance between maxillary and mandibular aspects while a person is in a comfortable posture and is also referred to as occlusal vertical dimension of the patient. This method is used most extensively. And another method is vestibule. That is, regardless of whether there is or isn't a tooth, central incisor, lateral incisor, and vestibular area of the mandible and the maxillary of the patient are situated at 38 plus or minus 2 millimeter position. Another method is one of the methods that we use frequently, that is, a method to use a freeway space. How we use freeway space as one of the methods we use statistically frequently. Then we will be able to restore the vertical dimension that the patient lost with two methods for measuring the distance between the vestibules. Another one discussed is the centric relation. If we have a tooth, we need to reproduce the height of interlocking of the tooth with the natural tooth that the patient originally had, which is referred to as centric occlusion. However, since there is no tooth, we artificially set the interjaw relation. In the Korean Academy of Stomatic-Gnathic Function and Occlusion in 1978, it was presented the centric relation is in the position in which the condylar head is directed in an anterior superior direction already when viewed from the sagittal plane. When placing it in this position, it is the proper position of centric relation and the starting point of all motion in the horizontal plane. Therefore, since all motions including frontal, lateral, and left and right start from the centric relation, finding the starting point is the way to find the centric relation. The central occlusal CO that we know of is situated at about 0.5 to 1 millimeters at the anterior aspect. Usually we can find CO when there is tooth, but when setting the new position in the case of a fully edentulous jaw, we need to find a new CR point. Dawson's bimanual method and chin point guidance are two of the methods for finding this. Dawson's bimanual method acquires bite by having the patient bite teeth after having situated the thumb at the chin of patient, at the back of the patient, and having condylar head directed to anterior superior direction by placing the remaining 4 fingers at the chin. For chin point guidance, when the thumb of one hand bites the chin, the condylar head is directed to the anterior superior direction by the head section in the middle. There is a method to secure this position. Diversified devices can be used. Lucia jig and leaf gauge, used between central incisor and mandible, have the function of having condylar head to be positioned towards the anterior superior direction, similar to the function of chin point guidance. In particular, the leaf gauge can adjust the vertical dimension using its thickness, thereby making it easier to acquire vertical dimension and bite at the same time. I also use leaf gauge extensively on TMJ splint patients. As you may be well aware, there also is a Gothic arch tracer. By situating Gothic arch tracer and Gothic arch point on one side, between the teeth of the patient, by manufacturing dentures or increasing vertical dimension, induce anterior and lateral movement to the patient. Then you will get an arrow shape like this. If the bite is acquired by situating the Gothic arch point at this point, which is the starting point of motion, we will be acquiring interjaw relation on top of the centric occlusion we know of. Now I will explain full mouth implant prosthesis by looking at a particular case. It was a full mouth case when I used the initial stage guide, and it was 5 years ago already. In the initial stage, edentulous jaw data were obtained mainly from the impression taking. The splint is made on top of it. The marker protrudes out on the inner surface of this device. The marker is very helpful in merging the edentulous jaw data in the model by placing the splint into the oral cavity and securing the vertical dimension before taking CT. It becomes the merger point. The surgical guide is manufactured in this way. The final prosthesis of the patient, if the patient lost the existing prosthesis, or if the existing one needs to be newly restored, is manufactured by using existing dentures made for that position. At first, by using marker data attached on the completely edentulous jaw state, 8 to 10 implants are placed for maxillary and 6 to 8 implants are placed in the mandibular. Generally, we do like this when performing full mouth surgery. This is the appearance before the surgery. The next photo is the appearance 2 months after tooth extraction. The next photo is the appearance of the final prosthesis. Among many questions I receive, the question of whether it would be implanted simultaneously at the time of tooth extraction or after the extraction is asked frequently. In the case of full mouth, I recommend to wait for a while after the tooth extraction for safety and then place implants. So, place the implants once the bone is healed. Since the maxillary needs maxillary sinus implant placement, immediate loading is not performed. I recommend the method of doing final prosthetics safely after waiting. This is the appearance 5 years later. It is possible to prevent bone loss substantially by using a guided surgery since the non-incision method is applied. The patient is using it without any problem 5 years after the surgery. The second case was also performed 5 years ago. If you look at the left top, you can see there are 3 points, markers in the splint. With this, secure vertical dimension within the oral cavity of the patient by using wax. The guide is designed by using data acquired from this position. Implant Studio is used most frequently. In the Implant Studio, there must be a jaw relation with the antagonist, so the prosthesis is designed first, and then the implant position at the bottom is decided next. Accordingly, interjaw relation must be available at the time of manufacturing guide for edentulous jaw patients. In addition, this is a case in which the vertical dimension of the patient was measured again for the final prosthesis and interjaw CR was confirmed by using a Gothic arch tracer. So it is merged using a model like this. 7 implants were planned and a guide was designed. This was designed to determine the position of the fix pin. A guide must be fixated in the firm state onto the antagonist by using putty or bite. Generally, it is safe if the guide is fixed with a fix pin before the implant placement. Manufacture Gothic arch tracer here by using wire on H-scan body for a prosthesis. Secure the centric relation by having performed various actual movements, including anterior, posterior, and lateral motions of the patient. Once vertical dimension and centric relation are determined, scan H-scan body by using an intraoral scanner. Since all the external surfaces of scan body are exposed, the interjaw relation of the patient enters the digital program safely like that. Then, custom abutment is designed through matching in the H-scan body. The matching process provides information on at which position and direction the implant has been placed. We then design custom abutment again at that position. A temporary bridge must be produced on top of the designed custom abutment. This is because we must think and correct that there are errors to perform final prosthetics. The setting of temporary is attempted and it does not fit well. It means there are errors. So to check such errors, abutments are removed for checking. As the method of correcting the errors, connect custom abutment within the oral cavity and scan again at that position.
스캔하는 겁니다.
This is the same principle of taking an impression again when there are errors in full mouth.
그리고 다시
There frequently are cases in which this custom abutment itself is CAD designed or in the format of the digital library.
라이브로 돼 있는 경우가 많습니다. 그래서 요거를 갖다가 매칭을
Therefore,
시키면
when this is matched, it is merged with abutment at the newly scanned position, and the corrected position will be displayed again.
다시 수정된 위치를 보여주죠.
Design temporary bridge once more at this position and attempt setting.
디자인해서 시작을 해봅니다.
If the settings align well, we move on to the final prosthetic stage.
바로 넘어가는 거죠.
The patient was already using a temporary tooth from the moment the custom abutment was attached.
사용을 하고 있습니다.
The advantage of zirconia is the ability to accommodate coloring with the gum color at the defective area.
자, 이렇게
As you can see, 7 implants were placed and connected at once.
한 번에 연결을 했습니다. 그리고 팔로우업을 했더니 어떤 문제가 일어났냐면
As the result of follow-up 3 to 4 years later, elimination of prosthesis margin began to occur, as you can see here.
마진이 이제 탈락이 일어나기 시작했어요.
This is due to mandibular flexion, when you open the mouth wide in the event of connecting the full arch case at once.
맨디블 플렉션이 있잖아요.
Elimination of adhesive occurs due to this flexion.
접착제가 탈락이 일어납니다.
Accordingly, it is possible to arrange safely only if the prosthesis is sectioned in a full arch case.
보철물들이 안전하게 오래
Therefore, now we plan to implant to manufacture 2-piece or 3-piece prosthesis. I recommend that you do the same. If the minimum number of an implant is 8 for maxillary and 6 for mandibular, we divided lateral incisor to lateral incisor, and from canine tooth to molar tooth, when sectioning with 3 pieces in general. For the mandibular aspect, it is advisable to plan implant from canine tooth to canine tooth, and from small molar to large molar, like this, for a 3-piece prosthesis.
요거는 이미 말씀드렸듯이 우리가 이제
This, as I already explained, there are cases in which we use dentures that were already used among the use of the information on patients to obtain data on the patient's denture.
이용할 경우가 있어요.
In such a case, the first thing to do is to take a bite, like this.
그리고 나서
Then, since the old denture used has poor precision, take a rubber impression here by using adhesive.
어드헤시브를 이용해서 러버 인상을 체득하는 거죠. 자, 러버
Once
인상을
rubber impression is taken and impression taking is completed by using bite, the denture is attached to the marker later on.
덴처에 마커를 붙이게 됩니다.
Take CT while having that marker attached.
상태에서
The denture with the attached marker is scanned by an intraoral scanner in as-is condition.
마커가 부착된 의치는
If the denture attached with the marker is scanned with an intraoral scanner and inputted to the program, it is possible to produce reversed edentulous jaw.
무치약을 만들어낼 수가 있고요.
Marker, by being merged with CT data, can accurately display inter-jaw relation in the implant studio.
임플란트 스튜디오에서 정확하게 보여줄 수 있습니다. 그렇게
A
해서
guide can be designed in this manner,
디자인할 수 있죠.
and you can perform surgery with this.
그다음에 이제 혹시 이걸 가지고 즉시
When performing immediate loading with this by any chance, remove the temporary tooth and scan the custom abutment used at the time of prosthetics.
제거를 하고 사용했던 커스텀 어버트먼트를 저렇게 스캔하셔요. 그리고
In addition, the interjaw relation of this patient can be taken easily by removing a portion of the temporary bridge.
악권 관계를 쉽게 체득할 수 있죠. 그리고 디자인된 미리 디자인된
When the custom abutment designed earlier is matched, the final prosthesis of the patient can be designed with the program without the model.
또 프로그램에서 파이널 보철물을 디자인할 수 있죠.
It is manufactured in 3
믹스로
pieces.
조작되어 있고
This implant prosthesis can be manufactured easily if the temporary bridge is removed and replaced immediately in the oral cavity.
쉽게 임플란트 보철물을 제작할 수 있습니다.
This is referred to as the double scanning method. This is a different case.
케이스인데요.
It is possible to manufacture a full mouth easily by using H-scan body and denture the patient used.
제작할 수 있습니다. 이거는
Remove a portion of the inner side of the denture like this and take on adhesive and rubber impression.
러버 인상을 체득합니다. 그리고
Then this denture is scanned.
스캔합니다.
If the denture is scanned with the intraoral scanner, H-scan body image remains intact.
그대로 남아 있죠. 그리고
If this denture and antagonist and bite are scanned, all information of interjaw relation is stored in the intraoral scanner.
구강 스캐너에 전부 저장이 되죠. 자, 그리고 이 의치는 반전을 통해서 H-scan body를
If this denture is reversed, H-scan body will be observed.
네, H-scan body가 나오죠.
If it is matched to this, the implant placement position will be displayed in H-scan body as well.
위치가 또 나와요.
Custom design is now possible at this position. We can set the temporary prosthesis on the design custom abutment. We set the ready-made temporary prosthesis. I already mentioned that there could be errors. It is possible to correct the errors that occur through the double scanning method I already mentioned.
더블 스캐닝 방법을 통해서 오차를 수정하실 수 있어요. 지금 보니까 템포러리와 커스텀 간에 오차가 있어요. 그러면 이때는
If there are errors between temporary and custom abutment of each can be scanned again.
다시 스캔하실 수도 있고
By scanning again, the state in which the entire custom abutments are connected and setting of the new temporary aligns well like this. It is manufactured into the final prosthesis. It is possible to make implant prosthesis of full arch much more easily by using the existing denture and H-scan body. Such methods are already being used by many dental clinics in Korea. This is a prosthesis manufacturing method that fully utilizes the advantages of H-scan body. If there is no existing denture of the patient, it is possible to take the vertical dimension by using something that enables taking of interjaw relation. This is a case in which a biting record, such as a splint, is used. Since the biting record does not attach well, it was attached inside the oral cavity by using impression material. After having measured the vertical dimension of the patient, take a bite impression at the desired position. Then, scan this with the intraoral scanner. This section scanned with an oral scanner already has interjaw relation obtained through bite and antagonist imaging. Then, to obtain the edentulous jaw section, erase the portion that already corresponded to the splint. This is a method that I used a long time ago. If the remaining section and edentulous jaw section are connected with the scanner, interjaw relation can be accurately positioned at that position and displayed on the oral scanner, since the interjaw relation of this patient is already stored in the oral scanner. Then, if an ordinary scan body is connected to this and scanned, it is possible to easily design custom abutment and temporary bridge.
템포러리 브릿지 요거를 또 디자인하실 수 있죠. 보시는 것처럼
Such a method can be used with an oral scanner if there is no existing denture that the patient used. Even if custom abutment and temporary prosthesis are made, there could be errors, as mentioned earlier.
오차가 있는데 그러면 실제 구강에서
Then, custom abutment with error in the actual oral cavity is scanned outside the oral cavity with a scanner like that.
스캐너로 구강 외에서 촬영을 해버립니다. 또 만약에 조정이 필요하다.
If adjustment is needed, adjust the abutment that needs adjustment and generate another data.
조정을 해서 데이터 하나를 또 만들면 돼요.
Margin is a supramargin.
그러면 저거
Then, make adjustments outside or inside that oral cavity.
그리고 다시 그거를
After having scanned this with a scanner and then scan with the oral cavity,
구강 내에서 촬영을 하면
it is possible to correct the position of even the corrected margin in the program.
프로그램에서 수정할 수 있습니다.
If so, the patient will be using temporary bridge from this point on.
그리고 수정된 커스텀 어버트먼트
When the jaw connected with the corrected custom abutment is sent from the data, correction is made through the matching process I mentioned.
통해서 또 수정된 부분들이 수정이 돼요. 그리고 여기에 이제 다시
Then, align the temporary prosthesis here once again.
맞춰보는 거죠. 이때 temporary
If the temporary prosthesis aligns accurately,
잘 맞는다. 그러면
manufacture the final prosthesis with this temporary.
제작해 주는 겁니다.
This is also manufactured in 3 pieces.
제작이 돼 있고
If there is a substantial defect in the tooth lengths, it is possible to process the gum with pink color, which is one of the advantages of zirconia, although it may not be aesthetic. As an aesthetic method, it is possible to process the gum with pink color extensively nowadays. Therefore, the prosthesis is possible like this. As the last stage, we will have a look at how to manufacture a zirconia hybrid prosthesis without a model. I am using this method mostly. For DO implant, if the implant position is determined before the surgery, the implant is placed and hybrid for temporary resin is provided. Occasionally, this can be cracked while using. I used it and found that it gets cracked easily. Accordingly, I am using the method of performing surgery and manufacturing the final prosthesis quickly with zirconia by connecting abutment after the surgery nowadays. Since there are diversified methods like this, you should examine them and select the method you find appropriate. A splint is made by positioning the marker in the impression model with the edentulous jaw data. If you look carefully, the marker is positioned at the alveolar ridge. Markers positioned at the alveolar ridge enable design that can produce tooth arrangement of crown bridge denture on the splint. Take a bite in this way and manufacture the final prosthesis by using this bite splint later on. As such, it can be seen that the splint manufactured for edentulous jaw data in the initial stage is being used beneficially up to the stage of manufacturing of the final prosthesis. Let's have a look at the video of this case. This is a splint that includes a marker. If the marker is positioned at an alveolar ridge like this, the dental system will perceive it as a crown bridge. Then the crown bridge is designed first, followed by a margin. It is possible to make a splint itself by designing gum like this. It is more convenient than the existing method of placing wax on the splint. As such, it is possible to easily take the interjaw relation of the patient on top of this if you have simple bite materials. It is possible to determine the implant position in the implant studio by taking a bite and positioning a splint within the oral cavity and taking CT. Tooth arrangement used at this time can be used as is in the implant studio again. This is because implant studio also needs the position of the tooth. That tooth arrangement can also be used at the time of designing the final prosthesis. Dentists and dental technicians designing full arch point out that bug phenomenon in which computer stops occur due to excessive content of the data while designing full mouth. These things can be prevented when copied tooth arrangement is used. Therefore, if the design of the tooth arrangement already made is copied and used, it is possible to perform sufficient works even with a small capacity. Surgery was performed using a surgical guide and UV implant was used. Multi-unit abutment is connected 2 weeks later. A portion of the splint is then removed and is scanned with a scanner while the housing is exposed. At this time, housing can be cut if it is too long to achieve the appropriate height. I delete about 2 millimeters for use. Then antagonist and housing are scanned. The next bite is the splint that I mentioned. Interjaw relation I had in advance before the surgery is used until the final prosthesis. In this way, crown bridge design for that housing can be performed in the dental system. Tooth arrangement design previously can be used in the same manner here. Hybrid prosthesis design can be completed easily by forming the gum. This is manufactured with zirconia and colored with pink for the gum section. If the housing connected to multi-abutment is connected immediately after seating, final zirconia prosthesis can be installed for the patient 2 weeks later. This patient also has no change in gums since flapless surgery was performed. Therefore, there is no major problem, even if the final prosthesis is performed. In this way, you can easily manufacture hybrid zirconia prosthesis in digital methods. This is the last case. The gum of this patient is somewhat inappropriate for a hybrid prosthesis. I decided to place the implant by deleting it since there is slightly too much gum. Make splint in the same manner as the previous case and fixate the surgical guide to place UV implant. For this case, bone reduction to the extent required was performed. After having secured vertical dimension, multi-unit abutment is connected once healing of gum is completed. Then, the final prosthesis is designed by using a splint that was used previously. Zirconia hybrid prosthesis can be attached within 2 to 3 weeks after the surgery in general, at which the healing of gum is completed. There are these differences before and after the surgery. I introduced a guided surgery and diversified digital implant prosthesis methods based on my experiences over the last 5 to 6 years. Although you may find these methods convenient or inconvenient, what is important is that, unlike the concerns of many people, it is possible to perform full mouth prosthesis restoration without a model by using only a scanner. Accordingly, I believe more convenient methods can be introduced in the future. I will, of course, continue to research and ponder over these methods. I will also continue to introduce methods I find advantageous to you through the online seminar. Thank you for watching.